So when I started Bespoke, I started to realize that there was a huge need just to kind of talk about taboo subjects in a way that was professional and not judgmental and non-biased. So it was kind of really looking at the faults in the medical system to really figure out why can't people talk about sex in really positive ways, and why can't we deliver the healthcare that people need? Who am I to judge what people do? I may not do a certain act versus what others do, but how can I analyze the act? How do I understand it medically? And then how do we really just get these people back to whatever they want to engage? And a couple of things, I think the way I look at what I do is how do you prevent injury? How do you prevent cancers? How do you kind of analyze things in a way that make prevention an issue? And then how do you now restore and rejuvenate? The restoration component is a lot of if things are hindering people from engaging, so skin tags, fissures, hemorrhoids, things that don't allow people to enjoy anal, how do we work towards surgically correcting that, or how do I work towards educating so that people don't have those issues happen again? And then also the rejuvenation side. I see a lot of women post-pregnancy, they have hemorrhoids, skin tags, or guys that are into fisting where it's a little too loose, and how do we kind of contract things and how do we tighten and make things appropriate for people to engage. And again, I think it's all in the name of bottoming, right? So many people ask me all the time from an anal preparation perspective of how do you prepare to engage anally? And there's many different ways. We'll talk about using enemas and cleaning and the whole cleaning process. But I think the key is diet component of how do you use fiber, how do you use certain elements of the oral supplements to allow things to either evacuate completely or to slow the transit down so that you're not having stool issues or issues of cleaning, right? We work closely with Tape 2 and Pure for Men, which a lot of it translates, doesn't necessarily need to be a male-oriented branding. That's what their goal is, but the actual flaxseed and the ingredients itself in terms of the fiber really help just regulate and then also kind of bind things so that now you evacuate it completely, okay? People ask me all the time, you know, how do you get to the point? You can't go from nothing to cock or big toys. It's gonna tear. There's not this and be like, oh, tonight, honey, stick it in and it'll be fine. It's not gonna happen. It has to be this gradual process. And we talk about it kind of post-surgically in terms of what we're doing, but it's a baby step each way. And so when you look at working from small to large, it could be even over 1 to 2 weeks. And it's 2 to 3 times a week, 3 to 5 minutes. A lot of people do this right before they shower. It doesn't necessarily need to be sexual. It could be more mechanical, and you could use me and say, Dr. Goldstein said to do it, right? Or you can bring it into your play, right? And make it to the point where now you're kind of slowly, gradually getting yourself ready. I don't want it to be a task where you're like, I don't want to do this and it's too much on my plate. So it's 2 to 3 minutes of slowly, a lot of lubrication, slowly inserting until you meet resistance, and then coming back out. And slowly inserting and coming back out. And then you'll know where your limits are. You should not have pain while you're doing this. So if there's ever any element of pain, stop. You're done for the day, take a couple of days off and try again. There's a difference between discomfort and pressure and pain. Pain in anal sex, everybody thinks that that's normal. It's not normal. So it should not be part of your routine. And we'll get into kind of use of poppers and drugs and things to kind of do as relaxants. I do not endorse using those. Not until you've proven to yourself that you can actually take things and then you're using it more from a euphoric perspective, not from a relaxation. Because a lot of times if you're using lubricants that have kind of lidocaine on it from a numbing perspective, or poppers, you're not feeling back there. So then what winds up happening is either someone's going to town and it really hurts and you don't know it, or there's just a lot more from an injury perspective. So you just gotta be careful with that. We can talk about from a dilation, but it's usually the small plug for 1 to 2 weeks, the small plug plus the medium plug for 1 to 2 weeks, and then finally up to like a larger plug. So it could be a 4 to 6 week gig before you're actually taking bigger and better, okay? The other subject always deals is douching. I don't think douching is appropriate from an anal perspective. We're trying to figure out a name, Greg and I. It was like booshing or something else that's a little more appropriate, or just anal cleansing. If your diet is appropriate and if you're using appropriate supplements to help bind, you really shouldn't have to clean out. I know everybody looks at me and they're like, oh my God, nobody's going inside me unless I clean. The reality is, prove it to yourself. So don't clean yourself. If you're going regularly and things are flowing, use the butt plugs with lubricants and take the plug out and just prove to yourself. Stool should not be in the canal where you are engaging. It's higher up. So people that over douche, they're always seeing stool come out and they're like, I'm not clean, why aren't I clean? It's because they're actually going too high with their irrigants, or they're using too much. Remember, the canal that's clean, that stool is not in, it's capable of taking most things. Forget fisting. Fisting's a whole nother hour conversation. We're not gonna get into fisting. But in terms of that, and so it's a key of proving to yourself. Now, if you're gonna use products, there's currently now not any product out there that I would say really targets the community of anal at all. There will be, so trust me, there will be. That's kind of things coming forward. But if you're using fleet enemas, if you're using water-based, if you're using saline, what winds up happening is it leads to drying out. The cells themselves kind of get desiccated from the chemicals, and then they have these like micro cracking inside. So when you look at HIV rates, when you look at STD rates, they're so high with anal intercourse because most people use cleaning products, and then those cleaning products are toxic. So it sets up kind of that barrier that now is broken. So now what happens is that you have transmission, blood to blood, semen to blood, all those types of situations. So if you can avoid doing douching or any anal cleansing, I would really be a big proponent of that. If not, it's less distension, it's less thinking of it as if I need to blow up the big balloon and then deflate the big balloon. It's more of irrigation. So thinking of like a colonic. If you ever had a colonic, fluid goes in, fluid comes out. Fluid's going in, coming out. So it's less is more. And try and prove that to yourself in terms of, again, using the plugs, engaging with someone that understands that it's okay to have a little bit of stool here and there. That's the par for the course, all right? Does that explain the douching side of things? Question?
So basically, it's best just not to do anything.
I think that you should be able to manage yourself more by using oral supplements like fiber, stool softeners, gentle laxatives, things that you can control from above versus irrigating down there. If you start irrigating, you're really just setting yourself up for more trauma. People can get fissures and tears and hemorrhoids. You can get what's called rectal prolapse. If people use too much of that, then they're using it now to have bowel movements. So what winds up happening is that the mechanism is stretching. So if you think of stool goes in there, and now the muscle squeezes the stool out. If you're over distending, that muscle becomes too lax. It doesn't work anymore. So what happens is when you really need to go to the bathroom, it doesn't function that way. So if you want to use it, great, do it, but it's gentle. It's a lot less of a force and it's less water. All right, and the same thing with if you're using shower hoses. People love the shower hoses. That's totally fine, but just again, controlling the flow, and it's a lot more of thinking of, okay, whatever's going in, I just kind of want it to rinse instead of actually being a douche. Does that make sense? Hygiene. I think a lot of it, and we'll talk about a little bit from a TUSHY perspective. TUSHY and bidets are super great from an external cleansing perspective. A lot of people will, if you don't have time necessarily for a shower, you can kind of use the anal cleansers and get yourself all clean, and then from an external perspective, use the bidet to clean externally and make it more appealing and smelling fresh, etc. I'm a huge proponent of bidets to begin with, just from an anal hygiene perspective. The less wiping that you're using, the better. A lot of the injury setup is from wiping, and so if you can actually cut that down with the bidets, it's so great. Obviously, we speak about all the time from an environmental perspective, the less toilet paper that we're using, the better. And then also, I am so not baby wipes or any of those wipes. They're terrible. I know they try and sell you on that you're going to be cleaning, the better, the more you use it, the cleaner you are. The reality is that it sets yourself up for a lot of dermatological issues. You get a lot of cracking, you get a lot of fissures in the area. Also, HPV is so huge, and when you're using those products, you can actually develop anal warts and kind of go from there. So I think, using bidets, specifically the TUSHY, which is super great. It's quick, it's easy, it keeps you where you need to be and just gets you going. A lot of the injury that I see from a surgical perspective is just people not using lube the right way. And you have to think that it's not a vagina, okay? It doesn't self-lubricate. And especially if you've used enemas or some cleansing, it's super dry and it needs a lot of lubricant. Now, lubricant is most of the time either a water-based or silicone, and we'll talk a little bit about that. But the reality is that any of the lubricants themselves draw water out and dehydrate the cells as well. So it's quite, you're constantly kind of battling dehydration of the cells, so it becomes an issue. With that, there are these, especially on here, that are kind of the plungers or syringes that really lubricate the entire canal. It's super, super important to do that. Specifically if you're doing the dilating, which we'd spoken about, really using these lubricators and really getting the entire canal allows for things to kind of really work. And what I find is that most people, especially in the gay world, all they want to do is stick the dick in there. That's it. Just like, okay, turn around, I'm going to push it in. But the reality is that there's so much friction in that you will get tears, it's painful, and it's not that stepwise progression that allows for appropriate relaxation. All right? So the lube shooters are great. I think you have to choose which lubes you guys want to use. Water-based lubes versus silicone. I think that there's pros and cons in different situations. Obviously, if you're playing in the shower, one versus the other. If you don't want to do laundry because the sheets are going to be quite dirty, then I think it's another. So I think you have to look at personal preference to figure out. Just remember that obviously silicone lubes on toys degrades, and also the same thing from a condom perspective. You just got to be careful with oils, etc., because they can break down condoms. All right, but again, it's really mostly what you guys feel comfortable using. I think of things mechanically and scientifically because I want to know which positions foster better mechanics, right? So when you're analyzing certain things, it's not only positions, it's where is the partner in relation to you? Where are you in relation to the partner? Are you on the bed? Are you on in the shower? Where are you? Because it changes everybody's pelvic angles and it changes how you're actually entering. So things that would be like from behind, if someone's behind and their cock is pointing up, no matter what happens, it's usually going to hit the back wall of the rectum and it's painful, okay? Versus the other way around, if you're, let's say, laying on your back, it's now going to hit your prostate, and that may not necessarily be, effective, okay? And with that said, it's analyzing and it's really thinking along in a scientific way as to, where is my rectum and where is my anal canal in relation to how I'm engaging? It's not so sexy during the act. I'm not asking you to get all kind of, but when you think of, that didn't feel well, you now need to kind of say, well, why didn't it feel well? Was I using enough lubrication? What was the positionings that we did? And how do we kind of change things in a way? So like, for instance, we talk a lot about kind of on your back. If you're on the back and it starts hurting you just because of where the angulation is, put a pillow underneath your butt in that area to lift yourself up a little bit. And then you'll see that the actual, and whatever, if you're using a toy or a cock, that it actually changes the angle and now it's fully entering where it needs to be. So I think it's really understanding what works, but then it's also talking to your partner. I think that's the key to a lot of what we're doing, is how does that feel? Does that get you off? Do you like that? How do we change this in a way to make it pleasurable for everybody? And there are certain positions that are never going to feel comfortable for you, and you'll analyze it and you just say, okay, you know what? I'm not going to engage in that position because I know it's going to set me up for failure. And then this leads us from a communication perspective. I mean, I think that there's not ever enough of communication. First, from a relationship perspective, right? Just because people never talk to each other in kind of sexual ways, but then also from a communication perspective on anal play. I think that there should be, just like you're going to, not that I play football, but if you play football, there's like, the pregame where you kind of talk about where and what, you let things happen, and then there's a postgame. And especially for people that, really have great sexual partners, it's really understanding and talking to each other in ways that allow people to just better themselves for the next time. This is what I deal with most of my day, which is trying to get this and this to function in certain ways that you've never tapped into before. If you've ever had sex with someone and they're able to completely open their ass and accept whatever size and whatever it is, that's kind of a genius that's there, okay? The reality is that 99.9% of people cannot do that. They cannot control it, okay? But when you look at the purest of bottoms, the people that engage anally all the time, okay? They're able to do a lot because it's a muscle. Just like you go to the gym and you're working out, you have to train that muscle exactly how you would any other muscle. So for instance, one day you go do your bicep curls, the next day you're doing tricep because one day you want contraction, the next day you want relaxation. But the fact of the matter is that our assholes are in contraction 99.999% of the day. So nobody ever thinks about the relaxation phase. And that's what we had spoken about in terms of using the plugs and engaging. You can't go from nothing to something big. It's not physiological possible, okay? You have to kind of gradually get yourself where you need to go, and it's a lot of mental components. And that's why I think starting off from an anal play perspective, you really should do this on your own. Don't bring it into your own sex, don't bring it into sex play yet. In the bathroom, water running, relaxing, trying to figure out, okay, how can I get this mechanism to actually work? And it takes time. Neural mechanisms really take time. I mean, I think one of my kids is learning how to do like this, and certain people can do that. But if you practice it, you'll get better and better, and it just takes time of recreating the neural mechanism. How can I relax appropriately in times that you need relaxation? And then how can I actually constrict so that everybody's getting the pleasure that they need? And that control is patience and time, right? And a lot of it is this also is identity, especially in my gay world. The sexual identity component of this is, if my ass doesn't work, if it's injured, if there's problems with it, it completely fucks with everybody's brains to the point where even if I get it fixed from a surgical perspective, that it takes a long time for me to work through their psychological aspects to get them to actually enjoy what they're doing. The science of sex, this is what I do. I don't think anybody in the country, in the world, is actually talking about the science of sex. There's a total science to what we're doing. How I look at it is threefold. I look at it as form, function, and then aesthetics, and we'll get into the aesthetic component. Form and function is how does the skin actually open up versus how does the muscle relax. And so there are people that have smaller pelvises that the skin is the constricting point. So if you are engaging and if you're using plugs and if you're dilating and you feel like, my muscle is actually relaxing, but the wrinkles in the skin that are finally expanding are just being caught. It's being taut and it's too tight. Then it's like, okay, how do we work towards stretching the skin versus the actual control of the muscle, okay? And again, remember, you can tear. Fissures are the main issues that we deal with, that I deal with all the time from an injury perspective. And tears are painful, they bleed, they can lead to a lot of long-term issues, and then also, obviously, you're not engaging where you need to be. So when I think of one versus is the skin an issue versus is the muscle an issue. And we'll get into kind of Botox work, but a lot of people, and I use Botox a lot, one from a surgical perspective to get people to heal the right way, but then also for people to engage the right way. So there are people that come to me that it's too painful to engage. How do they get to that point? And so using the techniques that we spoke about, but then also Botox relaxes the muscle. It relaxes the skin. So me placing it in certain places allows for people to engage where they want. So there are certain people that come to me where they're like, I have a new boyfriend, his cock is so fucking big. I can't take him, and I want to. How do I get there? And so we talk about using certain tools that we can do, changing positions, but a lot of times their skin or their muscle just won't allow them to get there. So what can I do from a surgical perspective to get them there? Botox, me opening up and stretching the muscle, doing some work to allow it to happen. Or the other way around, that my new partner has a small cock and and I don't feel him inside me, okay? My entire anal canal is actually too loose or elastic. What can you do? And again, I can tighten things, I can pull things together so that now it's back to where it should be. Aesthetics. Everybody that comes to my office has their viewpoint on what is their optimal aesthetics, okay? You may think that this is a perfect asshole. Others may say, hey, this is what I want this. The aesthetic component, especially in the anal world, is super, super important. It's the identity of what we do. When people say to me, God, why does people care about what their assholes look like? You have to say, well, why would you care about what your vagina looks like? What do you care about what your breasts look like? It becomes a sexual identity issue. And for everybody, it's different. There are times that I look at someone's ass and there's tags and it just doesn't look appealing to me and it doesn't bother them at all. They're engaging, they love it, and it's totally fine. Awesome. And then there's someone that has the smallest little thing that I'm like, your ass is perfect. And they're like, I want it fucking off. Right? So again, here I am. I'm not someone to judge what their identity issues are, but I will help people get them where they are. The only thing I say is that when I look at how I do plastic surgery on the ass, I look at it as if you're looking at a piece of art and it's symmetrical, you don't really look at imperfections. Okay? And so it's the same concept in the ass. If someone has something on the left side, if I create that on the right side, when you're actually looking at it, it looks fine because of symmetry. So when I'm looking, there's certain rules from an anatomical perspective and from a surgical perspective, but I'm also looking for, is there symmetry that is happening? And if there's not, I sometimes actually make symmetry. So if someone has an extra piece of skin on one side and I can't get rid of it, I may actually create something on the opposite side so when someone is looking at it, they think it's perfect. Does that make sense? So it's kind of an interesting field, per se, but it's so important because nobody talks about this. And I see people all the time that will not engage anally because of how they feel it looks. Or they're having sex and someone says to them, what is that? And it happens to most people. And you say, oh, it's not an STD. Oh, it's an extra flap of skin. Oh, you should get that checked out. All these certain things that can be remedied, we can take care of, we can get people back to what their aesthetic component is and how do we get it to be functional. Top to bottom, we speak all the time of how do we get people to engage the way that they want to. And people don't know that our services are actually out there. So one is, how do we educate people to understand anal in a way that is appropriate? They do not teach that in high school. I didn't learn it. Nobody really learns the sex ed of bottoming. But it's something that we're passionate about at Bespoke, to talk about it. And it's okay if you don't want to engage in certain ways, but you should know about it, you should be educated on it, and then it just kind of breaks down the barriers for our community. And it's not the gay community, it's kind of the anal community, to take it out of the taboo world and really bring it kind of into everybody's discussions, physicians' discussions. Do you engage in certain ways? Why not? Did you ever think about it? The question I always ask people when they come to me is, and they're like, oh, I'm a top, I don't engage in anal sex. And I always say to them, okay, is it that you feel from a psychological perspective that it's just something that I don't ever want to do because it's a dirty act, or I don't, and if you talk to them, most of the time they say, I had a really bad experience when I first started. Nobody ever taught me the right way to do it. But if you were to get me to bottom and we were able to do it, I'd love to do it. And that's a lot of my clients. Understanding people's functional limitations, analyzing them in a certain way to give them an outlook of how do we educate them, and then how do I surgically assess them and try and fix them. And then we've spoken already about how we use Botox in a way to really help relax. Nobody's gonna shit on the street if I give you Botox in the ass, okay? People ask me all the time. You will have a little bit more gas, okay? You will have a little bit more urgency, so you'll plan your life a little bit differently of like, if I have to go to the bathroom, you can't just say, oh, I'll go after the meeting, you have to go. But the reality is that it gets people to use those butt plugs and to achieve what they want without pain, and it kind of sets that psychoanalytical perspective so that people can engage the way they want. And then I think, like classes like this, and we're recording this, and we have some stuff tomorrow that we're doing in terms of educating. And obviously, I have 2 kids. It's trying to even get into the kind of younger generation of talking about sex in certain ways that makes people feel comfortable about it, and to really analyze their body, to figure out what is the best way to engage, how do we engage it, how do we endorse it. I don't have the right answer. I don't know how you teach a kindergartner all of these, but I think it's exposing people to different people, exposing people to different ways, and then as they progress, really getting a little bit more detailed into the right way to practice. A couple of things. Obviously, thank you, Pleasure Chest. They endorse a lot of positive practices, so it's super great to have them. So thank you guys so much. And from a TUSHY perspective, they put this on. TUSHY's great. We have them in our office, and I think they're super affordable. Really, really great in terms of from a cleaning perspective, an environmental perspective, and totally endorse them. All right. What is TUSHY? Good question. So TUSHY is the bidet we were talking about. There's a couple over there, but it's super affordable. It goes actually on your existing toilets, and then it just really allows, from an anal hygiene perspective, just a lot less issues. And I'll just talk from a wipes perspective. People love wipes because it's quick, it's easy, you feel clean. But what happens is that you use the wipes, and then you pull your pants up, and then it's the moisture that sits there. So you have to really be careful when you're using that. One, I don't think you should use that, but if you do, it's really make sure that you have enough time for everything to dry, and then you can kind of go from there. But people use it, and that moisture creates bacteria, creates infections, and can really be an issue. All right, I'll open up for questions. People have any questions at all? Don't be shy. Yeah?
Is it absolutely necessary to do like the graduated like size situation?
I think,
I feel like
yeah.
I've never used a butt plug before.
Sure.
I've done anal before.
Sure.
And I was okay, and I did find certain positions better than others. My current partner has like a very large penis.
Sure.
So it's maybe a little bit different, but I don't know. Like,
yeah, I mean, I think there are people that can, it depends on, again, what your practice is and from a relaxation perspective, and there are people that can go from, depending upon sizes. I think I usually tell people to prove to themselves that they can actually get to that. So you may have been lucky that a couple of times that you were doing it, but a lot of people, especially in the beginning, are so apprehensive and are so tight in that area that they're not able to get that full relaxation. So I think in the beginning, I usually tell people, if you're able to use the plugs and get to the third or the fourth size on the plugs and feel comfortable very quickly, then great, go from an engagement perspective. But I think the nice thing about using the plugs early on is that it also lubricates the entire canal. So what I usually tell people is, like, when you're ready to go for the first time, let's say to a huger toy or to a bigger cock, you need to kind of pre-lubricate that canal, and using the plug before you do that will kind of assist in that. And also it gets people to relax. So you may now say, okay, great, I'm gonna go and we're gonna have sex with my new partner, and then it's too big. How are you it'll tear. And so you're kind of setting yourself up for, well, if I were to gradually get myself to a toy that's similar size to him and I know that I can accept that, then it's just kind of risk assessing and lowering the risk of injury. But, there are tons of people, believe me, that just go right from it, but that's why I have a business, because they go right for it, and then they come to me because they have all this injury, right? But with that, I agree with you. There are people, when you look at the truest of bottoms, when a 16-year-old kid or a 17-year-old kid starts to engage anally, if you think of the penis sizes of a 16, 17-year-old, most of the time they're not so big. And then they gradually get bigger, and they're kind of dilating themselves. So they're having sex at 17, at 20, at 25, and so you think about the cock sizes as we are aging, it does get bigger and bigger as we're getting into the 20s, etc. They've already kind of dilated themselves. But again, you look at bottoms that, let's say you have a hiatus where you go from you're having sex all the time to now 3 to 4 months where there's no sex. In that time, it's a use it or lose it muscle. Remember, the muscle is 99.9% contracted. So if you're now contracted for 4 months straight without playing, how do you get back to the game? You have to kind of use plugs in between those times to keep yourself active, or find somebody and play. But it's like a use it or lose it type of muscle.
So if you're not on drugs and you don't feel pain, then it's still possible to be like tearing and all those things.
Usually you would know it. Tears are pretty fucking painful.
Okay.
Okay, yeah, they're super painful. You're gonna get kind of micro tears and a little bit like, hey, someone was inside me, okay?
Yeah.
That, I'm not, it's like, it's the true, and again, it's like, the micro tears, the next day you feel like someone entered you, and then maybe the subsequent day, but then after that you're back to where you need to be. This is like a true on tear. You're bleeding, it's super painful, and there's 2 spots usually towards the front, whether it's towards the testicles or the vagina, or towards the tailbone. The tailbone is the weakest spot in everybody's ass. Okay? And that's where, so certain positions, if you think that, oh, you know what, this is going to put a lot of pressure on the skin on the tailbone perspective, change the positioning, because that's the weakest spot in the ass. And that's where you may look at certain positions and then say, oh, that's setting myself up for injury. How do I prevent that from being an issue? Make sense?
Yeah. Would you say universally the easiest entering position is if you're not on your back?
I think the best position that I recommend is you in control. So let your partner kind of lay down and you insert, okay? Like you're on top to the point where, we can demonstrate.
Cowgirl.
Like this, right? So the cowgirl position. But it's you controlling the depth, because what I find is if you're laying on your back or in any other position, the person that's entering you is in control. And it's cool. I love that. But the reality is that in the beginning, especially when you're not fully lubricated, fully dilated, and fully accepting, you're setting yourself up for issues. So if you're in control, that's why I said using the butt plugs first before you engage or during anal play is awesome, and then you're already where you need to be, and then if you're sitting on top of them, you now controlling everything. Should I move my pelvis forward? Should I move it back? Should I go down? And then once the kind of the groove is happening, then you can kind of do what you need to do and enjoy what you want. Yeah?
What's the protocol for butt plugs?
Protocol in terms of how we use it?
Frequency, etc., etc.
So if you haven't done any butt plug work, I usually say, and what we could do is, if you want, you could give us emails. I have a kind of a protocol, or I think we maybe have it online on our website. But it's usually 2 to 3 times a week. A lot of times I tell people to do it at night, shower at night, run the shower, get it all nice and cool, and you relax. And then it's between 3 to 5 minutes each session. Think of it like going to the gym. If you're going to the gym and you're doing 8 to 12 reps of lifting, it's the same concept. I don't want it to be a task where you're like, shit, I have to do this again. I don't want that. It has to be. So it's 3 to 5 minutes right before you get in the shower or in the shower. And what you'll do is you'll take the plug itself and you'll lubricate it really well. Okay, and then what you'll do is you'll slowly insert. People ask me how, you can sit on them. A lot of times I just tell people kind of to just angle it to the point where you're standing and kind of bent over and push them in. And you'll go until you hit resistance. When you hit resistance, you stop. Check that neuromechanism to say, okay, I'm at resistance. How can I kind of relax the muscle? Holding it there, so it's constantly moving. So it's like in 3, 2, 1, hold it there, come back out. Relubricate. Go back in a little bit further, okay, until you hit resistance. There are 3 sets of major muscles in the ass, okay? You have to hit those 3 and get all of them to relax. So it may take some people 3 to 4 times to have all of those muscles relax. It may take people 8 to 12 times before it fully relaxes. When you look at these plugs, people love to sit on them and put them in. The thing is this, I don't love when you put the plugs all the way in, okay? I think that the plug should actually be flush, because what happens is that it gets stuck. So the muscle goes around this part, and then what happens is you start getting a little swelling, and when you try and pull it out, it's hard to get it out, and also you can tear. These are pretty good because they're quite flimsy, okay? But a lot of them can be quite rigid, depending upon what you buy. And so people love to put them in, especially now they have those Wi-Fi controlled Bluetooth, which are so great, and you can kind of like buzz people like, at work and stuff like that. But the thing is that, again, the muscle goes around this like this, and then it gets swollen if it's in there for too long, and then trying to get it out, you're like, oh shit, it's stuck in there, how do I get it out? Because of the suction effect. And so when you pull it out, you can actually tear. So I usually tell people to just go to the end here, but constantly always be moving in and out, okay? And then it allows, and then you'll gradually get yourself, again, because you could see in this one, the same thing. The muscle is here. If it's now swollen, how do I get that out? Sometimes, most of the times it can, but believe me, I've seen people pull it out and then they cause an injury. Make sense? So most people, 2 weeks, this one's pretty small. So most people should probably kind of start with like this. This would be like 1 to 2 weeks of using this plug. 3 to 5 minutes each time, 1 to 2 times a week. If you want to do more, that's great. If you want to bring it into anal play, that's great. Then kind of gradually getting yourself up from there to here. Most people, if you can kind of get to the base of the 2nd or the 3rd plug, depending upon which kit, you probably are ready to take on bigger things. And I find some people get hung up on the toy component. Toys are not really, even though you think, as flexible as cock is. Penis is actually a lot more malleable, even in the hard state, that you can kind of like maneuver a lot better. So if you're getting stuck from a toy perspective and you're like, God, I can't do that, but I want to engage anally, try it. Because a lot of times people can actually engage and get where they need to go and not be hung up from a toy perspective. Make sense? Yeah.
How long would you say it's been since our surgery? Been
How
a
long?
year?
Yeah, about a year or so.
So my story is at 14 years old, 32 years ago, I had anal sex when I was very young, and it ripped me so badly that all my life, for the past 2 years, I lived like that, thinking that was normal. And finally found my guardian angel here, had surgery. It's been a year, and I've been doing the butt plugs. Every night I dilate anyway, so I do the butt plugs and I go in different sizes. And it's been a journey. This past year alone, even just getting to the point where I can put something in there. I had sex for the first time 2 weeks ago, so
That's great.
with a real penis. Yes, thank you. And it was just like amazing, you know, just everything I've learned, and just, you know, it's like going to the gym, like you said. So now every night I do dilate, even though you said you don't have to do it every night.
Yeah, and again, it's really
I do it for
depends.
myself, just to, yeah. So,
We've come a long way, and if you
Yes.
I mean, we
Please.
did a lot of
what did we do?
we did a lot of restoration, a lot of rejuvenation. It was quite injured, and then we looked at it from a form, function, and aesthetics, and we made it look really great. And during that process, it was a tough process. And again, the ass heals really well. Okay, it's just sometimes it takes long. We have to shit. I can't prevent you from going to the bathroom. So if I could make you stop pooping, it would heal much faster, but I can't. So it winds up being, how do I work with kind of the mechanism that's happening now, but also kind of getting you where you need to go. And a lot of it is I can set someone up for success, but it has to be kind of a symbiotic relationship where the other person is really wanting to get there and doing the right using the right tools and kind of taking my advice to get you there. Yeah.
Some people say they have an anal orgasm. Is that true? Can it really happen?
Yeah, I think it totally can. I think it really just depends upon the neuromechanism. It depends on what they're thinking of is an anal orgasm. Is it just like a prostatic orgasm, just from the penetration because the prostate and the rectum is right next to each other? So a lot of it really just depends on what your definition is. An orgasm shooting cum all over yourself, or is it just that sensation of just absolute kind of intoxicating pleasure?
Or is there any type of fluid? Is there?
Right, and again, you can get fluid from just prostatic massage in and of itself. So remember, just from a penetrative perspective, if someone's behind you, most of the time they're going to be hitting your prostate. And so on two fronts, good and bad. Sometimes hitting the prostate causes prostatitis, where it gets irritated, it's painful, and people hate that. Whereas others find it so stimulating, where they're just flowing juices all over the place. So I think that it really just depends upon, and there are people that don't ever really ejaculate, but they really mentally have an orgasm that gets them off more so than actually having ejaculate and semen come out.
So it's not waste. It's a different.
So I think a couple of things. One is, it's the juice that's ready, right? So some people cannot even keep hard when they're being penetrated, okay? But they still get off in that way, okay? So I think that there's many different ways of how people engage anally and how it's fruitful for them. Most of the time, if they're having juices come out, it's not semen, most of the time it's the prostate. And the prostate produces that fluid that's gonna kind of allow the ejaculate to come out. So that's what you're seeing. And that's kind of where people view that. What else? Yeah?
What's the difference between a tear and a fissure?
Same thing. Yeah. So a tear is a cut. Fissure is just the scientific medical name for that.
Okay.
And so there's two types of tears, two types of
Skin tight,
fissures.
right? Not the same.
Not skin tag, different thing. So a tear opens up, and then what happens is that it's trying to find itself, but it can't because we shit every day. We go to the bathroom. So every time you go to the bathroom, it reopens up. And then you go back to the bathroom, and it reopens. And then so there are some really great days with it, and then there are some days that it just won't heal. There's two types, acute fissures and chronic fissures. So an acute fissure is it happens, and you treat it with medication in terms of suppositories, lotions, Epsom salt baths, stool softeners, and things to get it to heal, okay? 80% of the people, if you know what to do at that time, can actually get it to heal if it's caught early on. If it's something where it just is a persisting, nagging type of component, what happens is that scar tissue that's there is not strong. So what happens is that, yes, you can have a bowel movement and you're fine, but then you try and start to engage anally and the pressure is too high that it tears. Or you have a large bowel movement and the pressure tears the scar. When that scar tissue becomes so chronic, it needs to be surgically removed. So we clean up that scar so that now it's healthy and I can encourage it to heal the right way. And the same thing, I use Botox at that point to get the muscles to relax so that when you're going to the bathroom or when we're engaging that you're not so tense to allow things to heal the right way. Make sense? Yeah. What else?
Butt plugs.
Butt plugs? What do you want to know?
Well, you said you shouldn't put it all the way in.
Yeah.
So what about if you're using it while during sex?
So again, it really just depends upon where you are with certain things. So like, if you're using certain toys, you see how this one is a little bit more rounded at the bottom? So this one's probably a little bit better to get out and less from an injury perspective. So you have to kind of look at which specific toys you're using. But you have to remember, if you're clamping down, there's a suction effect. I have taken out plugs from people because they shoot up, okay? And so obviously, totally, they get stuck. So I think, like ones that won't allow you, I always said that there should always be like a tampon string at the end of every plug. It should be mandated on every butt plug that's ever made because there's a ton of problems with that in terms of getting it out. Because you have to remember that there's swelling and there's a suction effect. And the suction effect is not out. The suction effect is up. Okay? So like for instance, these that have the base, they're not going to be really an issue. Same component with this one, unless you have a really big ass, it's fine. This one can go all the way in. But you just have to be cognizant of all those issues and really understand kind of the mechanics behind it. And not really, that was what I was saying, is that I don't love people going beyond this. So find toys like dildos that are continuous, that are completely, that you're able to put in and there's no base to it to keep it in. I like those better. So I think, understanding, that's why the science behind all of this, that I think all the toys are great and exploring and doing, but understanding the science behind it allows for proper engagement.
What are some of the diet recommendations?
So yeah, it really just depends on you. So IBS is such a big thing that we deal with. So a lot of, especially in New York, everybody's stressed out like fuck here. And so you go to, there's days that you're constipated and there's days that you're not. So we work very closely with Take Two, right? And they have one that's called Pure for Men. It's a lot of different types of wheats and fibers to kind of add. Whether or not you can do that in your own diet is great. A lot of people can't. A lot of people can't take enough vegetables or enough roughage to sustain that. So that's why I think using supplementation, especially like nighttime, if you're using fiber at night, you drink a ton of water at night. You think you'd go to the bathroom and pee, but you don't. The water actually goes into the stool. So I'm a huge endorsed proponent of doing that at night, so a nighttime routine of that. If you're using steaks, if you're doing high protein diet, protein shakes, protein bars, binds you, it constipates you. So if you're fisting and you want to hold on to things, bringing in the protein will help, right? Taking Imodium and slowing the transit down is a way that you can go. If you're like, hey, I want to clean myself out, gentle laxative work is the way to go, like Miralax. Some oils are great. Some people love the coconut oils or doing the mineral oils because they don't get absorbed, but it lubricates the entire tract so you're able to expel.
Taking the coconut?
Mm-hmm. Yeah, drinking it.
Internally?
Yeah. They sell it in liquid form.
Oh.
Yeah. So there's a lot of those oils that they're not going to be. It's natural oils. It's just like taking the coconut juice, but they just extracted the oil with it. But again, a lot of people use it for cooking, and so if you're doing that, it's not going to be absorbed. It's going to be lining the canal and kind of lubricating everything. But a lot of it is like I talk about the lube is kind of variable between you and trying to figure out, hey, what works and what doesn't. And that's where using the plugs and kind of engaging and proving to yourself, oh, I'm clean. What did I do from a diet perspective? How did I change certain things? People come to me like, I have sex and I'm so dirty all the time. And we analyze, okay, what are they doing? How do we kind of bind things? I also compare it to like a dog taking a shit on the street. If you watch a dog, it's like perfect. It's amazing. They come out, it's like so cylindrical. They're like these little things, and they don't even need to wipe their ass, right? How can you achieve that? I think because their diet is so rich in fiber, and their diet is so different than the Western diet.
If you're using lube, like on the penis? Like, do you, or like when you're doing anal sex, do you do it on it and then on
Like on the shaft itself and stuff like that?
Which is like a combination of like putting it on your like asshole and
I think that the reality is that I always,
there's no syringe.
yeah, I usually tell people that the bottom itself, who you are engaging, you have to worry about your own lubrication. Yes, you want the guy that's going to insert to have lube on his cock, on his shaft. But pretend like they're not, because if you're already lubricated yourself, you're going to now prevent the injury. Does that make sense? Because I see it all the time where people are going to parties and things happen, and then again, the person, all they want to do is get their cock inside because it feels really good, and they want to do it very fast. Okay, so I would say yes, you should have it on their shaft, you should have it on their tip, and you should make sure that's lubricated. But realistically, you should have it externally on you, you should have it in your canal and already ready so that if someone says, I'm just sticking it in, that you're already at that point. Does that make sense? But yeah, I love it all over the place. The more you have, the better. Especially in the beginning as you're kind of really learning the ropes. It just sets it up for success. Yeah.
You showed something about an anal shooter?
Yeah, I think do you guys have here Pleasure Chest? I think they have here, but I'll show you what it looks like. It's just like a syringe that, here. So it just has lubrication at the end of it.
Mm-hmm.
And what you do is you just squirt a little bit on the actual syringe so that it's pre-lubricated. And then what you do is you'll just literally insert, squeeze the syringe, and squeeze as you're pulling out. So the entire tract gets full of lube.
So is that best?
Oh yeah, we have here. Thank you.
Is that like the best thing to use if you're starting to use gloves?
Yes, I think it's a good thing. I really do. The other way is just like I said, is where if you're starting with the small, that you're lubricating, and then when someone comes to my office and I'm putting in a small camera, okay, I'm literally lubricating. I'm going in until I hit resistance. I hit resistance, I hold it there. I tell them to relax. I come back out, re-lubricate, go back in again till I hit resistance, come back out, re-lubricate. And you'll see that each time you're kind of getting the entire tract completely lubricated. Whereas this kind of just takes care of that right from the get-go. I just don't have time to do that on everybody, but if you're at home kind of doing the same thing, what you can do is insert this, squeeze, and squeeze through the entire time as you're coming out, and then it will really re-lubricate that. And a lot of that people say all the time that they feel like their skin is tearing, and it's just because, without having that tract lubricated, the second someone gets past one of those muscles, it's now pulling the skin. So everything is being pulled in, and because of that, you tear and have issues. Versus it's all like the canal. It's just a hole. So how do you really lubricate the hole in the way to allow it to engage? But these are great. Yeah. What else? Anything? Yeah, sure.
Anal beads.
Beads.
What's the difference? What's the how do they?
Anal beads, a lot of it is just from a stimulation perspective because it just gets people off. So it's just like a great aphrodisiac, toy-ish type of thing. With that said, you gotta be careful with anal beads. Again, just from a size perspective, know your size of what your limits are. And the same components, you have to remember that anal beads, they go from, remember, the ball to then nothing after it. And so again, now getting that out, especially if there's swelling that's there. So you have to use them cautiously as you're doing them. They're great. I think you can do it. It's just a matter of, again, understanding the limitations behind it.